The CDC is recommending that all adults receive COVID-19 vaccination. There may be some instances where you would like to have a risk versus benefit conversation with your primary care provider. Those might be if you have a history of anaphylaxis to vaccines or other medications previously, if you're pregnant, or if you have an immunocompromised state.
Even if you've had the COVID-19 vaccine, the CDC still recommends all public safety measures such as masking, social distancing, and hand hygiene.
People fear that the vaccine for COVID has been rushed to market and is unsafe. And while this vaccine did come to market in a shorter time frame than what's typical for vaccine development, it's important to realize that in the time of a global pandemic, resources were all focused on one goal and one solution. So because of those added resources, things were allowed to take place at the same time versus where they normally would take place sequentially. So while clinical trials were taking place, phase 1, 2, and 3, we were still able to increase vaccine development and have it ready for rollout when the FDA EUA was approved.
The answer is no. The vaccine is a messenger RNA type vaccine that has been studied for decades now, and this is the first FDA approved under the emergency use authorization for a messenger RNA type vaccine, but it never enters the nucleus of a cell where the DNA, it is not able to alter the DNA at all. It stays in the cytoplasm of the cell and it's broken down and expelled within 48 hours.
The Pfizer and Moderna vaccines are scientifically very similar. Where they differ mostly is in their supply chain management, really, and how they need to be stored and the ease of how they can be stored by different facilities. So what you're going to be seeing is Pfizer being delivered to facilities that have a ultra low temperature freezer, where Moderna might be going out to outpatient clinics and doctors' offices that only have ability to have a normal freezer. That's really the main difference as far as our hospital side of things. From there on, the only other difference to patients would be the frequency. Pfizer is given in 2 doses 21 days apart, where Moderna is given in a 2 vaccine series of 28 days apart. They've both been tested in roughly 40,000 patients in their studies and have seen very similar side effect and efficacy profiles to date.
For more information, visit cdc.gov as well as your local county health department's website.